Welcome back. Today we meet Professor Carlo Tacchetti from University Vita-Salute San Raffaele of Milan, the scientific representative of Spoke 2, to whom we ask, where does the need to collect large amounts of health data on patients come from?
Allora, credo che sia esperienza comune che sia di medici che
Well,
di
I
pazienti.
believe that it is a
che
common
spesso
experience among both
patologie
doctors and
dello stesso
patients
tipo
that
in
often
pazienti
pathologies of the same type in different patients do not respond to therapies in the same way. This leads us to think that our ability to make diagnoses is not sufficiently precise to discriminate pathologies that are apparently different, but which vary from each other by small parameters. Or we are often unable to define which patients with a given pathology may respond to a given therapy. It means that there are still correlations between the data we have that are not clear, and that would probably allow us to better discriminate populations of patients with apparently identical pathologies within populations that may or may not respond to a given therapy, or have a more or less aggressive development of the specific pathology, and so on. In order to obtain this information, we need to analyze data. Much of this data is now in digital form. For years we have been collecting data ranging from clinical data, laboratory data, pathological anatomy data, diagnostic imaging data, but also data on the genetics of specific lesions or of the patients themselves. We also often have data on patients' behavior. All these data represent a mine that can provide answers.
What is a digital twin?
The aim of our Spoke within the D-Cube for Health project is precisely to create digital twins, that is, populations of patients with apparently the same disease who respond to a specific question. For example, will a given patient respond to a specific therapy, or will they develop an aggressive form of the disease to a lesser extent? For each of these questions, they can be segregated into cohorts belonging to the category of those who will respond to the question in one way or the opposite way.
What tool helps you sort and read this data?
Using approaches such as machine learning or even deep learning, artificial intelligence is able to extrapolate from a flood of data from numerous patients those factors that will specifically indicate the characteristic of patients who do or do not respond to a therapy, or who do or do not belong to one of the two categories we want to define. More often than not, these models are referred to as black boxes. That is, machine learning models are defined that cannot be explained. The model will define that a patient will respond to a therapy thanks to a parameter X, but we don't know what reasoning the algorithm used to arrive there, and so it will be difficult to use this type of algorithm in the clinic because there is obviously a problem of responsibility. If the prediction is wrong, it is the fault of the doctor or the algorithm. So we are also moving towards developing so-called white box models. That is, fully explainable models that present the decision-making process of the algorithm to the physician in such a way that the physician can decide whether to use it or not.
Who is collaborating on Spoke 2?
The Spoke is led by the University of Salerno, in particular by Professor Pietro Campiglia, and has as co-leader the University Vita-Salute San Raffaele, of which I am the representative. There is also the Bruno Kessler Foundation, which is represented by Andrea Simoni, and we then have a series of additional partners, some technological companies such as Porini and Aizoon, and some research and institutional bodies such as the Polytechnic of Bari, the IEM-EST of Palermo, the Teleton Institute of Genetics and Medicine of Naples, TIGEM, the IRCCS, Scientific Institute for Research, Hospitalization and Healthcare, Galeazzi, and the European Institute of Oncology, and also Cineca.
Are there interconnected working steps required to arrive at the definition of a digital twin?
The first step, which is primarily the responsibility of Spoke 1, is to define which parameters we are going to analyse and obtain the necessary authorisations from the ethics committees. The second phase we are in charge of is to take all the data collected for these patients' cohorts, and we are already quite advanced in the data collection phase for at least 3 of these diseases: multiple sclerosis, type 1 diabetes, and metastatic liver and colorectal cancers, in order to create the models. We then put together a group of experts who will develop the models, in which there are experts who will analyse the data, clean the data, try to get the most consistent data possible, and aspects that will technically develop the white box and black box models. It is this multidisciplinary force that will help us. Of course, all this will work on a digital platform that San Raffaele Hospital has already developed and is looking to further develop, together with Microsoft, within San Raffaele Hospital itself.
Any hopes for the coming months?
Our ultimate goal is to provide the country with models that can help the public health service to make the care of patients with these diseases more effective, thereby saving money by avoiding unnecessary therapies, improving processes, and ultimately improving the national health service in some way. All these models will be made available to the country through Cineca.
Thank you.